Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 12 homeopathic remedies for boil or abscess. What is a boil or an abscess or a furuncle? When a hair follicle lying deep in our skin get infected, skin above is inflamed, swells up, becomes tender and get reddened. The ultimate result is a boil or abscess or furuncle. Boil may be external as well as internal. What is a carbuncle? When multiple hair follicles get infected simultaneously, the result is a carbuncle. See, this simple picture is given. These are hair follicles. As it is infected, steps is showing. Now, boil a single hair follicle. From multiple hair follicle infection, carbuncle. What is the type of infection that causes boil or abscess or furuncle or carbuncle? Generally, Staphylococcus aureus is the causative organism that creates a boil or a carbuncle. This is the microscopic picture of Staphylococcus aureus. Who are predisposed to boils? Number 1, diabetics. Number 2, persons with weak immune system. Number 3, persons lacking nutrition. Number 4, persons with unhealthy habits. Number 5, persons handling skin irritants. Where do boils appear predominantly in our body? Number 1, face. Number 2, neck. Number 3, armpit. Number 4, thigh or buttock. How to prevent boil? Number 1, boil should never be pressed or pricked, for this may cause further complication. This is the pricking. This has been shown by a cross. That is, it is not advisable. Should not do this. Number 2, boil should better be covered with an antiseptic or aseptic cover with a daily dressing. Number 3, after attending the care of boils, get your hands washed thoroughly. Be aware of unhealthy practices. Unhealthy practice means actually taking things without adequate washing or with an unclean hand. Very often it happens in rural areas. Boys or men even, they can pick up fruits from ground and directly takes. This food contains a lot of bacteria since it is already laid on the soil. This cannot be done. This cannot be done. These fruits must be collected, washed properly, then it should be taken. This is one of the habit of unhealthy practices for which boils usually happens. Clothing, beddings should be washed with hot water mixed with disinfectant, then dried under bright sun or dryer at high temperature, because clothing, bedding may contain this type of bacteria, Staphylococcus. It is better to keep the clothing, towels, napkins, etc. of the affected person segregated. That is, who is suffering from boil, his personal belongings should be kept separately. General approach to manage boil, abscess. Preventive management. If there arises any internal or external part, a painful red inflamed swelling which appears to form a suppurating swelling, Belladonna 4 globules number 20 every 2 hourly may be administered for 24 or 48 hours. If nothing happens to arrest the situation, Hepar sulph 30 often contains the situation and keeps the suppuration off. But when once matter already has formed and suppuration has started or is about to start, Maxwell 30 would bring discharge of pus and finish up the case. If the open wound doesn't heal under the effect of mercury or Hepar, Silicea 200 are almost specific to contain the situation. If the boil looks erysipelatous, Apis bell, that is Apis mellifica and Belladonna should be used. If it is bluish, Lacerating should be used. General approach to manage boil abscesses. For acute cases, most preferred medicines are, preferred remedies are Belladonna, Hepar, Mercurial, etc., Silicea, Apis mellifica, Arsenic album, Bryonia, Chamomilla, Clachysis, Lidum Pol, Meserium, Phosphorus, Pulsatilla, Sulphur, Nitric acid, etc. For chronic cases, whether cold or congested, aurum, that is aurum-mate, calcarea carb, carbovage, conium, Hepar, iodium, lycopodium, marcasol, nitric acid, phosphorus, sepia, silicea, and sulfur. Now, remedies with indications. Belladonna for boil, burning, stinging, and pressed sensation in abscess with scarlet red loop and hot, cheesy or flocculent, great sensitivity to cold air, hepatic abscess and other glandular abscesses. Look at this image on the right hand side, the type of belladonna swelling. Hepar for boils, lacerating and pricking pain in swollen mass, throbbing, beating within skin highly within skin above, highly inflamed, hard, hot, swollen, pus scanty, bloody, smelling like old cheese, pain worse at night by exposure to cold wind. Hepar Arsenic album for boils. Intolerable burning pain when abscess threatens to become gangrenous, pus profuse, bloody, acrid, thin, having putrid smell, great debility, sleeplessness and restlessness. Apis mellifica for boils. Diffuse inflammation of cellular tissue. Picture number one is a cellular tissue. Ending in destruction, stinging, burning pain in incipient boils. Barretta card for boils. Inflammation of cellular tissue passing over into suppuration. Incipient suppuration of glands. 2. The gland is about to suppurate. Angostura for boils. Abscess of the angle joint. 3. This is specific. Ankle joint boils, angostura. Sulphur for boils. Chronic abscess with tendency to suppuration of persons with psoric or scrofulous diathesis. You know psoric scrofulous diathesis, the person having some history of tuberculosis in the family are called to have scrofulous diathesis. The persons, actually every persons in whose family the history of tuberculosis, they are generally called with scrofulous diathesis, stinging, throbbing pain, tendency to form ulcer. 1. Picture 1. This type of ulcer comes after evacuation of pus suppuration. Silicea for boils, control suppurative process, seeming to mature processes when desired, again reducing excessive suppuration to moderate limits. After matter has been discharged, it promotes granulation and secretization. That is, it cleans up the debris and make the things almost look natural. Silicea. Rastax for boils, abscesses for axillary or parotid glands, swelling painful to touch and discharging bloody serous pus, smooth, red, shining swelling, covered with little painful white vesicles. Coculus for boils, Superficial boil just above a root of nail of right little toe, picture 1 on the right hand side, with pain as if where a hot iron rod went into it while raising foot from the ground in walking. Mercurius for boils, slowly suppurating boils, hard, hot, inflammatory swelling. Picture number 2, with pulsating pain, pus, copious or scanty, bloody, corroding, thin and watery. Thin and watery are the characteristics of mercurius. Glandular for boils, induration after surgical operation, followed by suppuration, wounds raw, inflamed, with stinging pain, throbbing as if it would suppurate. Profuse and exhausting suppuration in traumatic abscess. Picture number 2. The traumatic abscess, actually the abscess which is formed after some trauma. Now, I have given one information for serious learner. If you want to learn more about homeopathic therapeutics on boil, please consult Dr. Samuel Lilienthal's Homeopathic Therapeutics. This is a world famous book. With this video ends. Thanks for listening and viewing. If any difficulty is faced, please write down in the comment section. I will certainly respond.